Hello and welcome to Group 2's presentation on immunizations. This presentation will include information about vaccines as well as debunk some of the myths and controversies surrounding them. We hope that this is a great reference for you so that you may have a happy and healthy future.
The recommended immunization schedule for persons aged birth through 18 years have been approved by the Advisory Committee on Immunization Practices, the American Academy of Pediatrics, and by the CDC. The hepatitis B vaccine is administered to all newborns before hospital discharge. The next vaccinations can be given after the age of 2 months. The rotavirus vaccine is administered as a 2-dose series. DTaP is administered as a 5-dose series given between 2 months and 6 years of age. HIV conjugate vaccine is administered in 2 or 3 dose primary series and a booster dose. Pneumococcal vaccines are administered as a 4-dose series, and an inactivated poliovirus vaccine is administered in a 4-dose series. The next 3 vaccinations can be given after 12 months of age. These include MMR, varicella, and hepatitis A. These 3 are administered as a 3-dose series. At 11 years of age, it is recommended that you receive the meningococcal vaccine, Tdap vaccine, HPV-2 vaccine for females, and HPV-4 vaccine for males only. Tdap is administered as a 1-dose vaccination. HPV is a 3-series dose. Meningococcal vaccine is a 1-dose administration followed by a booster at the age of 16 years or older. It is recommended that the older adults receive both the pneumococcal polysaccharide vaccine at the age of 65. They also need to get the zoster vaccine at the age of 60. There are routine vaccinations that you should receive. The first one is the influenza vaccine that you should receive every year. You should also get a tetanus and diphtheria toxoids booster every 10 years. The final recommendations are those for those that travel. They need to be vaccinated for hepatitis A, Japanese encephalitis, rabies, typhoid fever, and yellow fever.
Next, we'll talk to you about vaccine types and why it's important to get each one. First is the MMR. MMR prevents measles, mumps, and rubella. It's a 2-shot vaccination series. It's recommended to decrease the spread of measles. It's also important because of the increased immigration from travel to countries where measles is endemic. Next is hepatitis B. Hepatitis B is irreversible and causes severe liver damage. It's available for all age groups, given to newborns at birth. The schedule is a 3 IM injection within 6 to 18 months of age. It's recommended also for sexually active clients. Third, we have the Tdap, which stands for tetanus, diphtheria, and pertussis. Tetanus is an infection characterized by muscle spasm and causes locked jaw. Diphtheria is a serious nose and throat infection, and pertussis is whooping cough that is highly communicable. Tdap prevents tetanus, diphtheria, and pertussis. 1 dose of Tdap is routinely given at the age 11 or 12, and if it's not given at this age, you should give it ASAP. Pregnant women are recommended to get a dose of this vaccine because the danger of pertussis to the infants is deadly, and any person having close contact with an infant younger than 12 months, including healthcare professionals, should get a Tdap. Last, we have influenza. Different flu shots are approved for people of different ages, but there are flu shots approved in people ages 6 months on up. Flu shots are also approved and recommended in pregnant women and people with chronic health conditions.
Vaccine types continued. The meningococcal vaccine prevents meningitis and the deadly effects that it brings. There are 3 different types of vaccines available for the different types of meningitis out there. The recommended time to get them is at 11 to 12 years old with a single dose, and a booster dose recommended at age 16. The elderly should receive it, and it's recommended for college-age students, especially if they're going to live in the dorms. Anthrax, yellow fever, and malaria vaccines are specific to anybody in the active military and going overseas or traveling overseas. It depends if the disease is prevalent in that specific country. Ages that can receive these are 18 to 65, and people should only receive them if there is an increased risk for exposure. The chickenpox vaccine is obviously to prevent chickenpox. It is recommended at 2 doses at age 12 months to 6 years old. For the child with no history of chickenpox, it's recommended to get it at age 13 and getting 2 doses within a month's time frame. The varicella zoster virus is to prevent the shingles. There are 3 different types of vaccines, and people 60 years of age or older are recommended to get these. HPV vaccine is to prevent the sexual transmitted infection HPV, which is nearly the cause of all cases of cervical cancer and precancer. It's recommended in adolescents for females, according to the CDC, and currently 24 states mandate that the HPV vaccine should be gotten to enter into school. And keep in mind that all immunizations are recommended for each age group, especially if they are immunocompromised.
Vaccine myths, beliefs, and controversies. Autism, developmental disabilities, medical disorders, alternative vaccination methods, cost of vaccines, natural immunity versus acquired immunity, herd immunity, vaccine ingredients, and side effects. Many individuals believe there is a correlation between vaccines and autism. The belief is that vaccines cause children to become autistic. This belief has arose after a physician falsified information saying that vaccines lead to children becoming autistic. Autism is still not entirely understood how it is contracted, but there has been extensive studies and research from credible resources that show there is no link between vaccines and the caution autism. Natural immunity versus acquired immunity. Many parents believe that their children are healthy and that they will be able to effectively fight off a disease and then be immune. In some cases, natural immunity could be longer lasting, but that would require the child to become sick first. It is important to realize that many vaccines that are preventable diseases are fatal and can even occur in healthy children. In order for the children to become immune, they would have to survive the disease first before they had the immunity. Acquired immunity, also known as vaccines, are weakened or killed viruses that stimulate the child's immune system to produce antibodies that protect against the disease. This allows the child to create an individual immunity to the disease without having the negative consequences of actually contracting these preventable diseases like measles, mumps, polio, etc. Herd immunity. Many individuals believe vaccines can be avoided because of living a healthy lifestyle aids in herd immunity. Yes, having healthy habits are good for your health, but it cannot substitute for vaccines. Healthy individuals can get infections and have severe complications from vaccine-preventable diseases. Herd immunity is extremely important. It only takes a small amount of unimmunized individuals to spread disease and decrease herd immunity. Herd immunity is important for those who are medically unable to receive vaccines. Many of these individuals that can't receive vaccines are immunosuppressed, undergoing chemotherapy, or are too young and cannot receive vaccines, and their livelihood depends on healthy individuals receiving their vaccines. As previously stated, it only takes a small amount of unvaccinated individuals to compromise herd immunity, which can lead to the resurfacing of vaccine-eradicated diseases. Vaccines are extremely important and are needed to keep these vaccine-preventable diseases eradicated. Vaccine ingredients. This is the most important controversy. Many individuals are concerned that the substances in vaccines are toxic. Substances that these vaccines are used are adjuvants. These are used to help prevent contamination and preserves the vaccine. In high concentrated doses, these substances are toxic. However, these substances are removed before the final vaccine product. Tiny traces can still be found, but these are too small to have a clinical effect. Highly toxic substances at a very low dose can be safe. Stabilizers are also added to the vaccines, such as saline and sterile water, which dilutes the powders into liquids. Many people are not aware of it, but we are exposed to these small amounts of toxic chemicals every day. Most people are exposed to traces of mercury through consumption of fish like tuna. Vaccines are strategically concentrated and purified to amounts that are tested before individuals are being exposed. Side effects. The most adverse side effect is an allergic reaction. Allergic reactions can potentially occur from anything, not just vaccines. Allergic reactions can occur from any injection as well. The most common side effects of vaccines are that of injections: rash, redness, pain, swelling, irritation. There are strategic procedures in place to protect individuals through documentation, as well as each vaccine has a lot number. This is kept to keep track of any cases where, if something adverse or unplanned occurs, these can be traced and safety precautions can be implemented, such as getting rid of the other vaccines that were made from the same lot. Unplanned events can occur with any type of medication. Every person's immune system acts differently, and everyone has different things they are allergic to do.
So there are two reasons in which a person can be exempt from receiving a vaccination, either because it is a personal belief related to their religion or a medical exemption. The religious exemption is intended for people who hold a sincere religious belief opposing vaccination to the extent that if they were forced to vaccinate, it would infringe on their constitutional right to exercise their religious beliefs. An example of this is a Christian Scientist. It is a religion in which their written tenets include prohibition of invasive medical procedures such as vaccinations. However, this leads to a risk of increased infection. The risk of unvaccinated children contracting diseases such as measles is up to 35-fold that of children who have been vaccinated. And clusters with high numbers of vaccine refusers therefore pose a serious risk for outbreaks. An example of this is in 2008 in San Diego, California. There was a measles outbreak which was linked to a child whose parents had refused vaccinations. The second reason a person could be exempt from receiving vaccinations is due to their medical diagnoses, such as an immunocompromised child. An immunocompromised child is someone with an immunodeficiency disorder, someone receiving chemo for cancer, or if they have had a solid organ transplant within the past 2 months, or if they are HIV positive with a low CD4 count. Immunocompromised children are discouraged from receiving vaccines because their body is unable to form an antibody immune response. Therefore, the main therapeutic intervention for these children is through preventing infections. The children who are medically exempt must have a written form signed by a physician stating that they are not safe to receive a vaccination. Immunocompromised persons rely heavily on herd immunity so that others are vaccinated so that they do not contract the disease. There are various components of disease that people are allergic to, and therefore they are unable to receive the vaccine. These people are encouraged to receive any and all vaccines that they are not allergic to. The allergic reaction is usually mild, and any severe reaction is very rare. An example of this is a person who is allergic to eggs and therefore unable to receive the influenza vaccine.
The nurse's role during immunizations. First and foremost, the nurse should develop a partnership between the nurse, parents, and patients. Also, she should provide information sheets and sign consent before administering the immunization. The nurse should take into account health literacy level and then also work to do care management to follow up for future visit, vaccines, and titers. The nurse should provide adequate information about how vaccines work and suggested schedules. She can also provide information about spacing out vaccines. Finally, the nurse should educate the patient and their family to not get the flu shot or other vaccines when they are immunocompromised. The nurse should provide teaching about the positive effects that vaccines have on the world. We are the frontline advocate for vaccines. You can tell family members about the eradication of measles and polio due to immunizations. Finally, which is very important, that you should provide reassurance, comfort, and emotional support to the patient and their parents. You should allow parents to participate while giving the child an immunization.